Jai Hind guys, good to see you once again. And as far as today is concerned, you don't need to solve any MCQs. I'll be doing all the heavy lifting for you guys. That is, I'll be solving those MCQs and telling you hacks and methods to get those questions right where the options are closely matching. And we have been able to recall about 260 MCQs and another 40 are right currently in my PPT. So that makes it about 300 odd MCQs. A couple of them can be repetitions as well because they might be discussed by more than one faculty. But our objective would be to analyze this paper, dissect this paper, and tell you methodologies that should be followed. That helps you get optimal results. So very good evening to everybody. The audio and the visual part I think is perfectly correct. And Aryan, very hello to you. Then Dr. Hariharan, Dr. Nisha, Dr. Prakash. So Abhijit, Javed, in case I missed a couple of names, I do apologize for the same. I'm perfectly fine, Gautam, Jitendra. And I've been getting tremendous feedbacks on rapid revision. So thank you so much for that. If you found it useful, do drop in a heart. And I think we're good to go as far as today is concerned. Jai Shri Ram. So starting with the very first question. Hi, Dr. Ramiz Polo. Thank you. That's a good observation. Ashok, that is, thanks for the feedback. Tosef, then Dr. Donat Landsteiner. Okay, namaste. Nilu Manoharan, then Chirag, Jai Shri Ram to everybody. Mohit, Rajesh. So I think we're good to go. Let's focus on the job at hand. Thank you, Dr. Homraj. We have this old man having recurrent fainting episodes. Do let me know whether you need to modify the options or not. And this old man is having recurrent fainting episodes. So initially when I heard this question, I thought that it's going to be standard sick sinus syndrome. But then the question was saying that the ECG is showing P waves. And the moment you see that there is going to be P waves present, that would imply that sick sinus syndrome would not be present. And the highlight of this condition is that the P waves are not matching with the QRS complexes. As you can see, P waves are 75 and then the QRS complex duration is normal, but the number of QRS complexes is 35. So that basically means it is AV dissociation. Now, what is that condition where we have studied about AV dissociation? If you scroll through the rapid revision section, you will notice me talking about AV dissociation in third degree heart block. And when you read about third degree heart block, that's where the P waves and the R waves will not match. So I'll just highlight this. I mean, this is standard information that we have discussed, which is going to be number of R waves and number of P waves is not going to be matching, and that's going to be a characteristic feature that's going to be counted in third degree heart block. अब वो थर्ड डिग्री हार्ट ब्लॉक पूछता कैसे है, तो थर्ड डिग्री हार्ट ब्लॉक को वो चेंज कर देता है. Thank you, Ali, in case you find LLR useful. And yep, there was a question from that also, which I'll discuss in a while. At the moment, the basic concept is third degree heart block में the number of the P waves will not match with the number of the QRS complexes. Third degree heart block is also called as complete heart block, or the alternative name for that is called as Stokes-Adam syndrome, and that is what we had to pick up. So let's look at the options quickly. You see, I can easily rule out atrial tachycardia in this question simply because the heart rate is not more than 100. I mean, for tachycardia to be present, I need a heart rate more than 100. So, okay, doctor, even if there is no fainting episode, Rajesh, the number of P waves and the number of QRS complexes is the key word that you need to pick up in the question. That would not change the answer in the question. Okay, electrical alternance was in the options. I think, doctor, there was a separate question on cardiac tamponade that I'll come up with, but since you have commented, I'll just not jot it down as well, the electrical alternance. So yep, that's what I was saying. I mean, there's no need to modify this question, doc. Electrical alternance was a feature in a different one. And now you have to select between first degree, second degree, and then Stokes-Adam syndrome. So first degree heart block में क्या होता है? First degree heart block will only be having a PR prolongation more than 200 milliseconds. For second degree heart block, it's going to be Mobitz 1 or Mobitz 2, where there's going to be a prolongation of the PR interval, and then there's going to be dropped beats described. So since for this particular question there is no mention of any missed beat or dropped beats, as a result of it I can rule out option number A and option number C as well. The correct answer for this one is third degree heart block, and the third degree heart block का alternative नाम. यार दिक्कत क्या होती है? I mean, why most guys were floundering for this question, couple of those brilliant chaps did it correct also, is simply that they use alternative terms for the same disease. Like, third degree heart block would also be called as complete heart block, would also be called as Stokes-Adam syndrome, and that is what I've tried to emphasize here. So in case you have especially for your junior batches, if you have not listened to bradyarrhythmias, or if you're not very thorough with the topic, my suggestion would be just jump on to the bradyarrhythmia topic today only in rapid revision, and that's where you will find this bradyarrhythmia discussion very smooth, hardly will take in about 30 minutes of your time, and this would help you get these basic concepts right. Yep, doctor, you perfectly right, Dr. Goth, that there is a complete AV dissociation. I mean, that's the main hack to solve this MCQ, that atrioventricular dissociation हम दो जगह पे ही पढ़ते हैं. One is in tachyarrhythmia, that is ventricular tachycardia, and second is bradyarrhythmia, that's going to be complete heart block. So I think we are sorted for the first question with the options as well. And thank you, Dr. Sakir, for the confirmation that options were the same. There was no ECG, guys, in this one. It was simply a theory-based question. I just put the reference from rapid revision of PrepLadder here before you, just to emphasize कि भाई Stokes-Adams syndrome, which is discussed in bradyarrhythmia, sir, आधे घंटे का time लगा दो. I mean, you have to trust, obviously, reliable sources. You have to trust a particular source and you have to go about it. So I think Stokes-Adams syndrome कुछ मैं खास नहीं बता रहा. It's given in Harrison only. It's not that we have created that disease. It's just the fact that if you are going to analyze the data in 30 minutes, you would be good to go on the topic. So let's move on to the second one. Okay, electrical alternates, doctor, we'll keep that in mind. Considering AV dissociation, it would not change the answer. Moving on to the second one for today, we are having a patient who's having muffled heart sounds with a low blood pressure, and he's asking about yes, Ashok, I'm coming to that migraine pound wala question. So don't worry, I think you guys are gonna do great. So okay, fine. Patient has muffled heart sounds with a low BP, so he's basically talking about cardiac tamponade. He's talking about intrapericardial space pressure exceeding the left ventricular and the right ventricular end diastolic pressure, and therefore there is going to be impaired. Okay, backstride was mentioned. Great. So if they mention the word backstride, it's going to be a piece of cake for you. I mean, this is one question which I have said in my LLR also. I've said it in my routine discussions also कि आपको नींद से जगा के अगर वो पूछे ना कि cardiac tamponade की JVP finding क्या होती है, तो it's gonna be कि the filling of the ventricles is gonna be compromised, and because the filling of the ventricles is going to be compromised, there is going to be an absent Y descent. So I think if there is going to be no, doctor, it would not be a rapid Y descent, it would be a absent Y descent. And good evening, Dr. Niranjan. And okay, they mean yeah, okay, all the three components of backstride were described. Okay, muffled heart sounds, hypotension, and elevated JVP. Okay, fine. And then he's asking about the fact that you have to tell about what is the correct JVP finding for this one. So cool, guys, I think we are sorted for the first two questions for today. Dr. Shah, I think, in that discussion, I did listen to that, people were confusing between constrictive pericarditis and cardiac tamponade. दोनों में ही steep X descent होता है, पर difference क्या होता है? That is what I've explained. Steep X and steep Y is constrictive pericarditis, and steep X and absent Y is cardiac tamponade. तो I think वहाँ पे constrictive pericarditis और cardiac tamponade के बीच में वो बहस जो चलती है, that discussion that we have, which might have prompted that answer as a steep X descent. But otherwise for cardiac tamponade, the highlight is that there is going to be, yes, that's the key word, doctor, that's what I'm trying to say, that if there's going to be backstride, it means it's cardiac tamponade. There would be impaired filling of ventricles, and that is why there's going to be an absent Y descent. So okay, Sakir, cool, I think we sorted for this one. And yes, this is the question that I'm talking about. We discussed this in LRR also. I discussed it in even my routine discussions. So I want to know from you guys that was inferior wall MI word written in the MCQ, though it's not going to change the answer, but still, for my satisfaction, I'm asking you that was inferior wall MI written in the question, or was only ECG findings given? Okay, so it was a young patient and okay, inferior wall MI was not written in the question. Okay, somebody is saying written, somebody is not. So okay, let's try to solve it a different way. The question is saying that there are changes in lead number 2, 3 and AVF, and you very well know that this is going to be reading the inferior surface of the heart. So Nakvi Saab, I'm not very sure about that leak and something like that, but I think abhi ka jo hai, whatever is available, I think our job would be to dissect that. So if it is lead 2, 3 and AVF, it is studying the inferior surface of the heart, and it's going to be a STEMI because he has mentioned about ST elevation. So considering that, we have to go for a percutaneous coronary intervention. And my dear students told me that there was no PCI in the options. It was primary angioplasty. That is what I've also explained. No, casually हम non-medical लोगों को ऐसे समझाते हैं ना कि भाई जैसे rapid revision में भी आप देखोगे तो rapid revision मैंने ये समझाया भाई नॉन मेडिको को बताना है तो क्या है कि भाई कॉर्नरी आर्टरी में बलून डिप्लॉय करेंगे, दैट्स गोना बी बलून एंजियोप्लास्टी, दैट वुड बी डन. ओके, मल्टी स्पेशलिटी हॉस्पिटल वाज गिवन. Okay, symptoms for 1 hour. Okay, so that's a good input, doctor. Thank you so much. Symptoms for 1 hour, and then he has been brought into a multi-speciality hospital. So at a multi-speciality, I mean a tertiary care hospital, we would be having all the facilities. We will be having a cath lab available, and because of that, percutaneous coronary intervention, though PCI was not given, and Yep, got. Thank you so much for that input. 1 hour is mentioned. So, I mean, the earlier the better. I mean, if you're identifying, you see, ECG will start having findings in MI as early as the very first hour. So, if you don't need a biomarker to confirm the diagnosis. I mean, you will do a biomarker, that's okay. But if any one of the investigations are positive, then, things are going to be, in your favor. And medicine ने जान बचा ली. Okay. So I think if medicine helped, that's cool. The correct answer for this one is primary angioplasty. Balwant, कोई बात नहीं. That happens with all of us. Some questions will go right, some will go wrong. But I think that's a part and parcel of our mental our mental state, right? Our neurons are very, I would say, adaptable, but sometimes they flounder a bit also. So we do make small mistakes while solving MCQs. Doesn't matter, those silly mistakes would be affected. But okay, somebody is asking why not streptokinase? Doctor, that is the main point, that nowadays the treatment of choice for STEMI is not thrombolysis. We do not do thrombolysis. We prefer doing a percutaneous coronary intervention. So I think I would suggest you, doctor, to listen to the rapid revision part once again, and just do the 200 hours of rapid revision of PrepLadder thoroughly. I think you would be through with any exam per se, and this one is just one such example. So we sorted for the third one. Door to needle time, doctor, we have to keep as 90 minutes. That is from entry into the hospital. Jo door to needle time hota na, that we do not calculate from that door to needle time is not calculated from symptom onset. It is from entry into the hospital. So a patient came with symptom of 1 hour. From that 1.5 hour, I need to do a percutaneous coronary intervention. And you mentioned 2 hours also, doctor. That is first medical contact. So my suggestion for those guys, if you are juniors and if you have not listened to the main RR section, please go through that. और उससे आपका concept जो है वो ठीक हो जाएगा. Dr. Savi says streptokinase is contraindicated in ST elevation. No, doctor, that is not the case. Streptokinase is contraindicated in non-ST elevation MI. Okay, ji. Yes, Balwant, it's a part of life. We sometimes know the answers and things go wrong. So the next question talks about a lady with complaints of dizziness. ECG was done, and this was a narrow QRS tachycardia. As you can see, the Q and the R and the S is literally jumping on each other. So I can say that QRS in this is literally fitting into one small square. That's going to be like 40 milliseconds. So there is a narrow QRS, and why I can say tachycardia, because the RR interval in this patient is hardly about one large square. So the heart rate is atrociously high, about hitting about 250 to 300. So with that kind of an heart rate, I need to, the BP would start crashing. And yep, I am getting multiple feedbacks for the options in this particular case. Drug of choice, I think, sir, drug of choice word nahi tha. I think in this exam, when I was talking to my students, उन्होंने मुझे बताया कि there was no word like drug of choice. It was like first best treatment, first step to be done, first investigation to be done. And similarly in this MCQ, the option was what is gonna be the best treatment. Okay, 55-year-old lady with palpitations. That's a good input. I mean, this would definitely help your juniors as well. 55 years old lady with palpitations, narrow QRS tachycardia. That would turn out to be a paroxysmal supraventricular tachycardia. And what we're going to do in this case is we're going to ensure that those fast impulses due to re-entry phenomenon around the AV node are not able to cause further deterioration and crashing of the BP of this patient. So we're going to use adenosine in this particular case. And Valsava, I think first treatment, okay, I think it is best treatment available, and considering the very fast heart rate, I think we have to select in this particular case drug only, even if Valsava is given. Though we start with Valsava maneuver, actually में Valsava करना बड़ा मुश्किल होता ना सर. Valsava maneuver के लिए you will have to make the patient breathe out into a syringe. तो सोचो किसी का हार्ट रेट इज गोना बी सो फास्ट एंड यू आर आस्किंग टू ब्लो आउट इनटू अ सिरिंज. वो जो रूटीन सिरिंज होता है ना, उसको उल्टा करके उसका जो स्मॉल वाला नोजल होता है उसमें ब्लो आउट करवा रहे हो. सो दैट्स गोना बी डिफिकल्ट, नो. और इफ आई जस्ट पिंच माय नोज राइट नाउ एंड आई try to breathe out. I mean, एक तरफ मुझे palpitation हो रहे हैं and I'm trying to breathe out. It's gonna, I mean, if a doctor is gonna ask me, you know, I'm having palpitations and somebody is gonna pinch my nose and say, breathe out as hard as you can. I mean, I'm gonna say, hato piche. Right? It's simply not possible for somebody to be so bad. So I've explained that we go for carotid sinus massage and we don't go for Valsalva maneuver because of the practical aspects that this would be difficult to perform. So we are sorted for the third one. Let's move on to the next one, where we have this 52-year-old lady. She's having a sudden onset face deviation with slurring of speech and inability to raise right arm. So all focal neurological deficit manifestations are given in this case. And then the question mentioned that there is going to be resolution of symptoms. I mean, this is what I want to know from you, that were the symptoms beginning to resolve on their own by 48 hours or was some intervention done? I mean, did this question mention that there was some kind of a intervention in the form of mechanical thrombectomy or any intervention in the form of MRSI, solitaire, any endovascular therapy or thrombolysis that was done and then there was an improvement, or whether there was a spontaneous improvement? Because if there's going to be spontaneous improvement and complete resolution of symptoms in this particular case, then it cannot be stroke. The reason for why she is having these neurological features is because there is a mid-diastolic murmur. So that tells us that this lady is probably suffering from mitral stenosis. Now you guys are aware as doctors that mitral stenosis will cause structural damage to the left atria and the left atria will get dilated. This is going to cause a development of a arrhythmia by the name of atrial fibrillation. How do I know it is atrial fibrillation in this MCQ? It was written irregular heart rhythm. So considering that this atrial fibrillation will be causing clot formation in the left atrial appendage, and then these clots will go out of the heart into the brain and they can cause a possibility of a cardioembolic stroke. Initially, when I listened to the version of students, I thought it is a straightforward case of cardioembolic stroke. And then one student told me, no sir, there was an improvement in the condition of the patient also given. So just to reiterate, let me know whether in this particular question, there was any improvement in the condition of the patient. If there is going to be improvement, spontaneous resolution, then the answer for this one would be TIA, that is a transient ischemic attack. So cool guys, I think all of you are right. And other options were like thromboembolic stroke, cardioembolic stroke. So what is happening in this patient is cardioembolism. I mean, this guy is literally sitting on a volcano and the clots are going in the brain. So we need to start aggressive anticoagulation in this particular case. But you perfectly right, considering that there is a spontaneous improvement in the neurological features. By 48 hours, everything is self-resolved on itself. So we're going to call it a TIA. We should be starting this patient on dual antiplatelet therapy. And I'm really glad you guys did it correct. So cool guys, really, really very nice. I think, Gungo, that is a very interesting observation that you've done. That's a very deep-seated observation, and I think that you should share that with your juniors as well, that if they really want to, you know, crack this exam, get into that 180, 200 wala zone, then they need to do these aspects, what you've said, that is LLR. Then after that, there's a couple of questions from FMG and NEET PG, and you are through. Okay. नवेद सर 24 आवर्स में रिजॉल्व होता है? हाँ जी, तो वो रिजोल्यूशन तो सर सब्जेक्टिव है ना. आई मीन यू सी, पेशेंट को तो एग्जैक्ट वो तो हमने आर्टिफिशियल कट ऑफ बनाया ना कि 24 आवर्स में इंप्रूवमेंट हो जानी चाहिए. उल्टा है, अगर इंप्रूवमेंट नहीं हुई 24 आवर्स तक तो विल से स्ट्रोक है. बट अगर इंप्रूवमेंट शुरू हो गई है तो देन इट इज़ लाइक 24 to 48 आवर्स में द पेशेंट इज गोना बी फाइन. सो इट इज स्टिल अ ट्रांजिएंट इस्केमिक अटैक डॉक्टर. इट्स लाइक दैट. जो 24 आवर्स आप समझ रहे हो ना, दैट इज अदर वे अराउंड. इट इज नॉट कि 24 आवर्स में इंप्रूवमेंट विल अकर. इंप्रूवमेंट स्टार्ट्स विद इन फर्स्ट आवर ओनली इन अ ट्रांजिएंट इस्केमिक अटैक. कंप्लीट रेजोल्यूशन टेक्स टाइम, सो दैट वुड बी स्टिल 24 to 48 hours. So okay, so even Vicky Patel, if there's a improvement in the symptoms of the patient, yeah, VT was amiodarone, doctor, that is pretty sorted. But then I think why not a cardioembolic stroke? Doctor, the reason for why we'll not call it a cardioembolic stroke is this word that I'm asking you. Stroke में कभी spontaneous improvement नहीं होती है, spontaneously begin to reduce. अगर आप ये word हटाते हो तो मैं cardioembolism को agree कर सकता हूँ, लेकिन अगर आप बोल रहे हो कि सर symptoms कम होने शुरू हो गए, तो अपने आप से stroke के symptom तो या तो movies में ठीक होते हैं है ना, जो टेलीविजन सीरियल्स होते हैं उसमें किसी को स्ट्रोक होगा और फिर वो दे विल डू सम some kind of magic potion will be given to the patient और अपने आप से स्ट्रोक ठीक हो जाएगा. अदरवाइज तो सर ठीक नहीं होता, राइट. सो that's my point against saying that why it is not stroke. You don't have an improvement. There would be neurological features then present in the chap. So moving on to the next one, a very interesting one. He said there is a patient with mitral stenosis and he developed sudden onset respiratory difficulty. हाँ मयंक, take it cool man. ऑटो 240 मैंने बोला ना, 240 250 हमने एनालाइज किया है अभी तक. अभी ये 40 और हैं आपके पास में, तो अगर 150 वहाँ पे ला रहे हो तो और आगे the score will definitely improve. Now we are having a lady with mitral stenosis and she is having a sudden onset respiratory difficulty, limb edema and pain in the calves. So respiratory difficulty basically means that there could be pulmonary edema developing in a patient. That would be left ventricular failure. And if there is a limb edema, that means it is right ventricular failure developing in this patient. He says, what is the clinical diagnosis? Pulmonary embolism. Pulmonary embolism will not result in development of, this sudden onset limb edema in a patient. Pulmonary edema, pulmonary embolism and deep vein thrombosis can contribute to features of respiratory difficulty and pain in the calves. That is understandable. But my point against pulmonary embolism is that pulmonary embolism would be having pulmonary oligemia. The blood supply to the lungs will become relatively lesser. It will not be causing cardiogenic pulmonary edema. For cardiogenic pulmonary edema, and the limb edema part which comes up here, that's one of the distinguishing factors which makes the diagnosis of this case as pulmonary edema. This patient is not having features of stroke. There's no focal deficit, there's no speech deficit, so cerebral embolism can be ruled out. And paradoxical embolism क्या होता है? Paradoxical embolism is seen with patent fossa valis. इसमें क्या होता है कि जो deep vein thrombosis के clots होते हैं वो patent fossa valis से left side of the heart में चले जाते हैं और left side of the heart से जाके वो stroke cause करवा सकते हैं. तो again paradoxical embolism results in development of stroke, which is why I've ruled out the two options. So we have to select between pulmonary edema and pulmonary embolism, and the point against pulmonary embolism would be that development of that limb edema. Everything else would be suggesting features of congestive heart failure for this particular case. So we are sorted for this one, doctor. And no doc, there are different questions, doctor. There are two different questions. आप miss up कर रहे हो. And डॉक्टर गोहिल सेड कार्डियक टैम्पोनाड फिजियोलॉजी वाला. हाँ डॉक्टर, मैंने समझा दिया ना कि स्टीप एक्स और स्टीप एक्स दोनों में होता है, कॉन्स्ट्रिक्टिव पेरिकार्डिटिस एंड कार्डियक टैम्पोनाड में. सो एब्सेंट वाई विल बी द डिफरेंशिएटिंग फीचर. वो अलग क्वेश्चन है सर. वो जो लिम्ब इज रेड है ना, वो मैं दिखाता हूँ आपको. दैट लिम्ब इज रेड वाला अलग से क्वेश्चन है. सो दैट विल ऑल्सो कम अप. आई जस्ट मूव अप. दैट लिम्ब इज रेड वाला इज अ सेपरेट क्वेश्चन जिसमें इन्वेस्टिगेशन पूछा था. सो दैट वुड बी अ टोटली डिफरेंट वन. Okay, considering that there is a limb edema, there is pain in the calves of this particular chap, we would say that this guy is going into congestive heart failure. This would be cardiogenic, guys. This is cardiogenic, considering that this is a known case of mitral stenosis. So considering that, we'll not say pulmonary embolism. In a mitral stenosis patient, that duplex wala aa raha hai, sir. Wait. That I have that question, sir. I've done the hard work and collected like 42 questions from out of 300 for you guys. So give me some time to just say them before you. In mitral stenosis, it's a cardiogenic pulmonary edema and not pulmonary embolism, as I've explained. And then the next question that I'm going to discuss before you is going to be based on definition of Kussmaul sign. The meaning of the word Kussmaul sign. Dr. Stoner, the DVT and bedridden will come up. डीवीटी हिस्ट्री वाला क्वेश्चन अभी आएगा सर. सडन ऑनसेट में पल्मरी एडीमा कैसे? तो सर पल्मरी एडीमा जो होता है वो सडन ऑनसेट ही होता है ना. पल्मरी एडीमा इज नॉट गोना बी लाइक ग्रेजुअल ऑनसेट, राइट? इफ देयर इज अ लेफ्ट वेंट्रिकुलर फेलियर mitral stenosis patient would be having this. This does not mean LVF. It basically means features suggestive of pulmonary edema in a patient. That would be suggestive that there is a left-sided pathology present, because in mitral stenosis there is an obstruction at the level of the left atria. So there would be elevated pulmonary capillary wedge pressure, and this elevated pulmonary capillary wedge pressure will explain the pulmonary edema component in this particular case. So this is not going to be pulmonary embolism. Considering mitral stenosis के case को या फिर pulmonary embolism के बोलेंगे, we'll say cardiogenic pulmonary edema. Keep simple diagnosis first. Okay, so once we are sorted for this one, MS having cardiogenic pulmonary edema, we're looking at a question in which Kussmaul sign was given. There is an elevated JVP of 12 centimeter of water that rises with deep inspiration except. Let me know regarding the options, guys, and this question can be solved on that mnemonic by the name of CRR. That would be okay, that patient was bedridden. Okay. भाई अगर माइट्रल स्टेनोसिस का पेशेंट है और उसको सांस लेने में डिफिकल्टी हो रही है तो उसे पल्मरी एम्बोलिज्म क्यों बनाओगे यार? अगर माइट्रल स्टेनोसिस के मरीज को सांस लेने में दिक्कत हो रही है तो पहले पल्मरी एडीमा कंसिडर करेंगे ना. ओके, Coming to the next one, this question is based on Kussmaul sign because he's saying that there is going to be elevated JVP which is going to be rising with deep inspiration. Traditionally what we have is that JPP would fall with deep inspiration. Since it is rising in this particular case, so we would not be in a position to, we have to use the CRR mnemonic in this particular case, and we have constrictive pericarditis, we have right ventricular failure, we have restrictive cardiomyopathy, but this would not be seen in patients of hypertrophic cardiomyopathy. So this would be option number A. Rajesh Kumar Nirmalkar, there's a separate question on deep vein thrombosis जो आप लोग बोल रहे हो, अभी आ रहा है वाला question pulmonary embolism वाला, that would come up in a while. But at the moment what we have discussed is pulmonary edema versus pulmonary embolism. Abhi there are two more questions. One was regarding investigations for deep vein thrombosis, that would come up, and there's a separate question जिसमें the limb was red, patient is bedridden, and that's where pulmonary embolism would be answered. So answer to this one is option number A. Koki Kumaro, can you just comment on the question Pulsus paradoxus would be absent in okay, cardiac tamponade was given. Fine, doc. I mean, this is what I was wondering for because there were two questions on cardiac tamponade. One I've already discussed, and the second one would be probably this one, that CRR mnemonic helps you pick up features of Kussmaul sign, and उसमें constrictive pericarditis होता है, restrictive cardiomyopathy होता है, right ventricular failure, which is written as cor pulmonale in this one. So उसमें से तीनों में से निकाल दो तो the remaining one would be the option that is hypertrophic cardiomyopathy / cardiac tamponade, whichever would be present would be the answer to this particular question. But the concept for Kussmaul sign is what I've tried to explain here, and if you deploy this mnemonic जो मैंने बार-बार re-emphasize किया हुआ है, then we will be able to solve it. There are 40 odd MCQs, doctor, in medicine that we are going to be discussing here. 40. Okay. Okay, it was about Pulsus paradoxus. Okay, HOCM था. Yes. Okay, Pulsus. Okay, the question was regarding Pulsus paradoxus. Okay. Okay, fine. So even Pulsus paradoxus, no, that would be seen with respect to cardiac tamponade, but Pulsus paradoxus would not be seen with respect to hypertrophic cardiomyopathy. So fine, guys. If it is elevated JVP 15 centimeter of water, okay, this is 15, great, instead of 12. Okay, fine. So I think the logic is still correct, whether you talk about Kussmaul sign or whether you talk about, Pulsus paradoxus, because Pulsus paradoxus is also seen in constrictive pericarditis. Any hypotension वाले stage में Pulsus paradoxus होगा, लेकिन Pulsus paradoxus would not be encountered in patients of hypertrophic cardiomyopathy. There you would be having features of they would be having Pulsus bisvariance present. Okay. Thanks, guys. Thanks for this correction. And I think the question language was different, but the ask was the same. I think so. We are sorted conceptually for this one as well. Okay, fine. Then we had two questions on lumbar puncture findings. One had this keyword of HIV positive patient. His CSF examination was showing lymphocytosis. Indank was also given, and that would mail the diagnosis of this particular case as Cryptococcus neoformans. You don't need to bother about the lymphocytes and the proteins for this particular question. The answer is based on one, there is opportunistic infection in an AIDS positive chap, and Indank study is also given. Why the answer is not pneumococcus? Because pneumococcus भी तो Indank में दिखाई देता है, but the pneumococcus is not the answer because pneumococcus will be having low sugar with respect to CSF, and you will be having neutrophils present. So they have done this previously in Fmge exam, that they have given India Inc. and answer was pneumococcus, but how it was pneumococcus is what I've explained. If you have low sugar in the CSF, if you have neutrophils present, no issues, then your answer is pneumococcus. If it mentions normal sugar, increased protein, then it would be Cryptococcus neoformans as an answer. Pneumocystis jirovecii, why it's not the answer? Because it will cause a pneumonia. Tuberculosis will again cause a lung infection. So you have to select between A and D, and that is what I've done precisely at the moment. And now we look at another question on lumbar puncture, which was only with CSF findings. This particular question, guys, okay. In this particular question, what I would like to know is CSF examination showing lymphocytosis with normal sugars. Doctor, that depends on your ability to recall also, no? Because the perspectives have to be dependent. And then there's another one that says CSF examination shows lymphocytosis with normal sugar and there's an elevated protein present. So considering that there is a lymphocytosis in an Indian exam, you first think in terms of TB, but then point against TB would be a normal sugar value. And if it is a normal sugar value, then it is going to be viral meningitis. This would not be pyogenic meningitis. Okay, so there was only one question on meningitis. Okay, cool guys. If that is so, that is perfectly fine. And for this particular question, it is not tubercular, guys. If it is normal sugar with lymphocytosis, it's always going to be viral. Explained multiple times, tubercular is the first possibility with lymphocytosis, but they would be a grossly elevated protein. He has to mention regarding cobweb coagulum, that gross elevation. Yeah, signs of meningeal irritation was given in this question. Okay, fine, doctor. Signs of meningeal irritation. Fine. So what you need to understand is that CSF findings will change with respect to different infections. If it is pyogenic, that's when you have neutrophils present. If it's going to be tubercular, it's going to be, yeah, lymphocytes is perfectly fine. Lymphocytes is perfectly fine. If cobweb word is written, then it's okay, man. If you have answered tubercular meningitis, take it cool, man. If it is written cobweb coagulum, if it is written low CSF sugar, then it is turning out to be tubercular meningitis. So if your set had the TBM, great. But the way the lines are at this moment, it's going to be answered as viral meningitis. If this is the data, your answer viral meningitis is perfectly fine. If you're going to be having a low CSF sugar and elevated protein, that's all diagnostics are all about, right? If you're going to be having lymphocytosis, low sugar, elevated protein, cobweb coagulum, then it would become tubercular meningitis. Okay, moving to the next one. ये वाला था, definitely था. You know, meningitis में दो question थे. मुझे एक तो 100% sure है ये cryptococcus वाला. That is not an issue. The second one is debatable, so we'll remove it from the final set that we make for to be available in the app. And moving to the next question, they said a high dose dexamethasone suppression test was done, and both before and after, ACTH values are extremely high. Now the point is कि ACTH is ultra high, so दो option rule out हो जाते. Exogenous source, if somebody is taking steroids from outside, ACTH will be less. If somebody is having an autonomous tumor, which is again going to be producing cortisol, ACTH is going to be less. C and DA can be ruled out. Why? Because ACTH values are less in both of them. Cortisol values are elevated in all four conditions. That is okay. But the point is ACTH is going to be less in exogenous source because of feedback. Adrenal adenoma again. You're left between two, pituitary adenoma and ectopic source. Ectopic source would mean lung cancer. You cannot suppress a lung cancer. Lung cancer to matlab mast mola hai, right? He's gonna do his own thing. He's not gonna follow anybody's advice. So ectopic source is gonna be a condition where ACTH before dexamethasone. आप कितना भी dexamethasone दे दो, lung cancer को नहीं दबा सकते. Pituitary is still gonna respect a bit of physiology. So it's still gonna get suppressed. But you cannot suppress lung cancer. That's why ectopic source is the answer for this particular case. This would either be a carcinoid tumor, because there are two reasons for this. Either it's going to be a carcinoid tumor, or it's going to be a possibility of ectopic source producing ACTH. So absolutely right, absolutely right. Okay, cool, Ali. That was a great solution. Chronic smoker also given. Okay. That's a very good hint, man. If he has mentioned chronic smoker, the answer is like literally he's placing, he's gifting you the answer for this one. Okay, chalo, cool. Let's move on to the next one. The image may not be the exact one, but hand ka flapping tremor present tha. So this current image shows presence of asterixis. There is hyperpigmentation and weight gain also. Okay, I'll just jot that down, doctor. Just give me a sec. There is a hyperpigmentation in this clinical question. That's understandable. ACTH has a MSH-like activity, and that is the reason why there's going to be a hyperpigmentation present, and there's going to be weight gain in the patient as well. So, okay. Doesn't matter, doctor. The answer will not change. High dose dexamethasone will still keep the answer as ectopic source. But if he's gonna give you the data for a chronic smoker and he's gonna add up hyperpigmentation, it gives more credibility to the diagnosis. The answer would still remain the same. Okay. The next question that I'm showing you, the image may not be an exact replica, but this is a question which is going to be asterixis of flapping tremors. The reason why this can be happening is because of ammonia levels being elevated, that is hepatic encephalopathy. It can be uremic encephalopathy, that is elevated urea. It could be elevated carbon dioxide. So this would be hypercarbia, guys. Thyrotoxicosis would not be a correct answer. Why? Because they would be fine tremors. In this particular case, hemibolismus would be having wide flinging movements at the shoulder. So this can be ruled out. And anxiety neurosis would again be having fine tremors present. So A and D have fine tremors, and then hemibolismus would be having wide flinging movements here. Okay, the image is same. Weight gain. Gohil, weight gain is a feature in Cushing syndrome. Ultimately, lung cancer is going to cause a cachexia, that's okay. But initially, lung cancer is producing excess of ACTH, no? So there's going to be high cortisol, and cortisol will explain the weight gain of the patient. Okay, hypoxia was in one of the options. That's okay, doctor. Hypoxia will make a patient irritable. It will make a patient angry. And hypoxia is what would cause disorientation. So, I mean, asterixis क्यों होता है? उसके तीन asterixis का reason होता है metabolic encephalopathy, and metabolic encephalopathies are three: hepatic enceph, uremic enceph, and then hypercarbia. The correct answer for this one would be option number B, as you can see, and I have just modified option number D as hypoxia. Okay, okay. Okay. I don't think so, doctor. There was carbon dioxide retention. Yeah, it's okay. It's same thing, doctor. Whether you say आप बोलो hypercarbia या बोलो carbon dioxide retention in a patient, तो concept तो same ही रहेगा ना sir. If there is a CO2 retention, it will cause hypercarbia. Okay, so even in an asthma patient, no, there can be acute exacerbation of asthma that can cause carbon dioxide retention in a patient. See guys, the answer cannot be hypoxia. Let's be very, very clear. So if you're trying to change it to hypoxia, no. But if you say कि sir hypercarbia नहीं था, CO2 retention भी नहीं था, and suppose you say it was asthma, right? So asthma में CO2 retention होती है, क्योंकि ultimately asterixis का concept is not gonna change, no. So it has to be either a liver failure. If it's not, then you say sir kidney failure. If you say sir kidney failure भी नहीं था, so I have to select one option where there is some kind of a parenchymal lung disease which is going to cause a carbon dioxide retention, where there's going to be some kind of a, I would say, hypoventilation present in a patient. So this would not be answered as hypoxia and would be answered in the favor of the data that I have mentioned. Okay. No, doctor, it would not make a difference. This also looks like side to side only, no? The hyperextension of the palm, and then it looks like going side to side. So I don't think so that would make too much of a difference, because the flapping tremors could be occurring in any axis. So thyrotoxicosis में तो fine tremors होते हैं doctor, ऐसे वाले fingers के tremors होते हैं ना. Like suppose you are going to be operating on a case first time in your life and you are having a surgical blade and you're going to give an incision, तो हाथ कांपेंगे ना आपके. That heart kampana is going to be fine tremors with anxiety and can be seen with thyrotoxicosis as well. Then we come to this question which everybody was talking about. There is going to be a unilateral pulsatile headache in a woman which is exaggerated on eating meals. Tension headache is always a diagnosis of exclusion. Cluster headache I can rule out because there is going to be retroorbital pain. There is going to be watering from the eye, epiphora present. Malingering is option which would not be, I mean, you would not tell a patient that, okay, you are malingering and describing a headache. You have to first think of an organic cause, and then only you have to think in terms of malingering in a possibility. So I think everybody scored this one correct. Considering pulsatile headache, that pound mnemonic that I have explained will do the trick for you, and you can just go through that in rapid revision section. The migraine part, 10 minutes into that topic and you would be on your way to solve any question with respect to headache. Moving to the next one, a very interesting one where you had to calculate the curve 65 score. So what you need to help me in this particular question, okay, photophobia and phonophobia bhi tha. Okay. Fine, I'll just add that, doctor. There was mention of photophobia, there was a mention of phonophobia in the question as well. That gives even more credibility. Good, you guys are picking up words, no? Because that photophobia, aversion to light, aversion to sound, is again a disabling feature that's seen with migraine, because of which daily abilities would be hampered. Now what you need to do for the next question in the comment boxes, I want maximum comments in this one. Comment on the age of the patient first, right? Then the next thing is, was there any altered sensorium described in a question? respiratory rate was 40. So in a single comment, before I say anything else, please comment on the age group of the patient, whether there was altered sensorium. You can just write yes or no for that, and respiratory rate of 40, and I'll go ahead subsequently into the labs of this patient. Let's do it stepwise, guys. Let's do a calculation of curve 65 score. I've already emphasized curve 65 score is something जो मतलब आना ही आना है, वो values उसकी usually दी हुई होती हैं कि भाई you know the questions would always talk about curve 65 score in an exam. हाँ जी डॉक्टर असगर गोरी, विल कम टू दैट क्वेश्चन. स्मोकर बेंट फॉरवर्ड येलो स्पूटम, दैट इज ब्रोंकेक्टेसिस क्वेश्चन, दैट इज कमिंग अप. अभी आ रहा है. ऑल्टर्ड सेंसोरियम वाज देयर. सो एज वाज लेस देन 65. सो कर्व 65 मैं लिख देता हूँ, राइट, एंड देन विल वर्क आउट द आंसर फॉर दिस वन. इन कर्व 65 cannot was not there, age was not there, right? Then respiratory rate was more than, so I'm putting a tick mark for that. That is 1 mark. Respiratory rate is more than 30 per minute. Age was 22 years of age. Doc, we coming to Naved, just do it stepwise, right? Otherwise we'll just mess up the things. So respiratory rate is gonna be 40. That's okay. Altered sensorium was there in a question. So at the moment the score of this patient is 2. The current value of score of this patient is 2. The labs are showing a serum creatinine of 1.9. I think that was the exact value. Couple of guys reiterated. Please comment now. Please comment now. Okay, bun was not there, so I'm going to remove that. Good for me. If bun is not there, that will mean that the score of the patient is going to be 2. This is the final interpretation. I'll say that once again. I am basing my answer on the fact that the curve 65 score of the patient is a final value of 2, and that would mean that I need to admit the patient. If the score was 3, I will do a ICU management. Let's look at the options here. You would not, I mean, a guy is really sick, you know, he cannot be managed with oral drugs at all. So this is out of league. You have to select between an IPD management and an ICU management. If the curve 64 score in this question was 2, the answer would be IPD management. If the curve 65 score in this patient was 3, let us assume, suppose bun was given and bun was elevated. You guys are saying there was no mention of bun, so that is why the score is taken to be 2. Suppose bun was given and the values were ultra high, more than 7 millimoles, then we will do ICU admission in this particular case. Based on the inputs provided by you guys, we have worked out that the final score of this patient is 2, and the correct answer for this question would be IPD management with IV drugs. So I think, let me just check out the comment. Yep. Creatinine was there. Absolutely. बहुत बढ़िया, वेरी बढ़िया. आईपीडी मैनेजमेंट, ये स्कोर वैल्यूज देख लो ना यार, ये स्ट्रेट फॉरवर्ड सा है कि स्कोर 0 होगा तो ओपीडी पे ट्रीटमेंट कर लेंगे, अगर 1 से 2 के बीच में स्कोर होता है तो हॉस्पिटल एडमिट कर लेते हैं, और 3 या 3 से ज़्यादा होता है तो फिर उसको भर्ती करना पड़ता है, एंड वील हैव टू एडमिट हिम इनटू इंटेंसिव केयर यूनिट. सो आई थिंक वी सॉर्टेड फॉर दिस वन, एंड दिस वाज मोर ऑफ दैट conceptual kind of a question where you will have to evaluate. Okay, Vaishnav says bun is there. So let me know the bun value, doctor. Just let me know the bun value. नहीं, not a problem. हाँ, अभी यश, अभी तो बहुत जल्दी है. अभी अगर आपने सीधा ही करा है और तो नहीं हो पाएगा. You have to work harder on this one. Okay, so if considering that bun is not given, then we'll have to answer this as a score of 2, and then the answer for this one would be IPD management. If bun was given to be more than 7, I think 7 value कहीं थी नहीं. I think 1.9 ही सब बोल रहे हैं. मैं अगर assume भी करूँ ना, even if I assume that this serum creatinine was bun value, that bun of 1.9 is not dangerous. Bun has to be more than 7 millimoles, as I explained, and I've written that normal value. There's no, the reason why it is in red is just to sensitize you to the fact that I mean, these datas have to be remembered. So the answer for this one is option number B, and let's move on to the next one. I think this was the question on deep vein thrombosis that we were talking about, that there is a post-operative patient and the limb of the person has become red. There is a calf pain in this guy. He has also been having breathlessness present. Okay, bun was there 7 millimoles. So doctor, if it is gonna be 7, then it's not a cause of concern. Values more than 7 are ones which are to be considered. Okay, post-operative patient is having calf pain present, so the diagnosis in this case is deep vein thrombosis, and I think it was in this question that there was history of immobilization that couple of guys were commenting earlier as well present, and there was a development of deep vein thrombosis. So I'll be doing a duplex in this case, and the diagnosis of this particular case can be made. So for calf pain anyway, I mean, I need to identify deep vein thrombosis. Let's look at the next one. After a major surgery, a 60-year-old patient is developing respiratory distress on the third post-operative day. Now, after a major surgery, if there is going to be immobilization, there's going to be respiratory distress. It means that there is a clot. The clot will break up from the leg veins, go towards the heart of this patient, and would cause pulmonary thromboembolism. So this again becomes relatively easier. Sudden onset distress post-surgery. Do comment in the chat box for this one, guys, whether the language is fine. Okay, okay. D-dimer was not in the options. Okay, CT angio was in the option. Okay, okay, that is CTPA, no? CTPA or CT angiography is perfectly fine. और डीप वेन थ्रोम्बोसिस के लिए तो बेस्ट या नेक्स्ट जो होता है वो डॉपलर ही होता है डॉक्टर साहब. डीप वेन थ्रोम्बोसिस के लिए वेदर यू से नेक्स्ट or whether you say best, the answer would still remain the same. For deep vein thrombosis, it's always going to be standard data of duplex ultrasound only. Why not atelectasis in a patient? Okay, okay, this one, we coming to this. A patient is having major surgery. You see, doctor, atelectasis can be prevented by doing physiotherapy. But pulmonary thromboembolism is usually a mishap that is bound to occur, especially if precautions are not taken and low molecular weight heparin is not given after major surgery. So if it is going to be morbid, if it's going to be morbid obesity, okay, yeah, it helps, doctor, it helps, absolutely it helps, because if it's going to be morbid obesity present in this question, then considering morbid obesity, the bedridden state of the person will be exactly increased subsequently. Okay, please mention about the blood pressure. Dr. Gohil, let the comment come up, sometimes the part of the comment is hidden, so I'm not able to see the exact question there. Okay, MRI and CT contrast was given. Okay. Okay, got it. It also mentions regarding MRIs. Doc, that would not change any options, no? Whether you say next or best for deep vein thrombosis, it would still remain a duplex for this particular patient. हाँ डॉक्टर रैम्पेज, हेड इंजरी और एपिलेप्सी में होता है ना कि हेड इंजरी अगर किसी को हुआ तो वहाँ पे स्कार बन जाएगा ना, इवन इफ यू डू अ क्रेनियोटमी एंड देन पर्सन कैन हैव अ एपिलेप्सी. सो देयर इज अ क्वेश्चन ऑन द सेम एज वेल. वी आर जस्ट कमिंग टू दैट एज वेल, दैट क्वेश्चन ऑन एपिलेप्सी, बिकॉज वी नीड टू गिव फेनिटोइन टू द केस so that we can prevent that possibility of seizures to be occurring in this particular patient. So okay. Okay, Medlarni in the very first question. Electrical alternance, doctor, but that would not change the answer to this question. High sub-zero, good. Let's move on. This one is sorted. Moving to the next question. Patient is having problems doing a heel to a shin test and repeatedly misses doing a finger nose test. Considering heel to shin test is coordination, finger nose test again is missing. That means that this guy is having lesion in the cerebellum. So the answer for this one would be option number A. And I think, yep. Do comment, guys. Do comment regarding this one. Okay. Fine. Moving to the next one, this is what you guys were saying. A patient is having a yellow sputum that increases significantly on postural change, and the patient has been having these problems for a substantial amount of time. So considering that, okay, intentional tremor word was also given. Okay, thank you. So considering that intentional tremor is also present, pyramidal tract lesion was in one of the options. Okay. Fine. So for if there's a cerebellar lesion, it would contribute to these coordinations basically. Yep. And a patient is having a yellow sputum that is going to significantly increase on postural change. That would mean that there is going to be a reservoir present there. And considering that there is a reservoir, either it's going to be lung abscess or it's going to be bronchiectasis. And considering that this particular chap is having this problem for a fairly long time, extrapyramidal rakesh is same as basal ganglia ना, तो उसमें ऑप्शन में कोई फर्क नहीं पड़ता डॉक्टर. ये जो ग्लोबस पैलिडस वगैरह ना, तो मैं EPS कर देता हूँ उसको, extrapyramidal system, pyramidal tract lesion. I mean, I think that's we are sorted for this one. Okay, there is a yellow copious sputum in this particular guy. Okay, that's Gohil. Okay. Gohil, your D option still did not come. That's severe wala. So just let me know, or try to just type in again. I'll just see. Okay, this guy is a smoker and he is also having copious sputum that increases on postural change, and this would favor a diagnosis of yep. Okay, recurrent A is bronchial asthma. Okay, so this is asthma. Okay. Cancer for this question. Yeah, that is copious foul smelling sputum. That's okay. Okay, in early morning. Yes. Okay, one of the options was cancer. Fine. So I think that is making it easier for us, because if it's going to be lung abscess, that's going to cause very severe symptoms. There's going to be high-grade fever, chills and rigors in a patient. And considering that, these are the options: asthma, lung abscess, bronchiectasis and cancer. The correct answer for this one would be bronchiectasis. Hanji, मैंने हटा दिया आलम. I have removed that. I am temperature से related था क्या? Okay, that sputum more in the morning increased with change of position. The age of the patient was 48 years. So I think, guys, this was a pretty straightforward one on bronchiectasis, which is going to be destruction and dilatation of the large airways, and there's going to be positional dependent copious lung secretions present, or the expectoration of the patient is going to be affected by the position of the body, which is why bronchiectasis is the answer. Okay, so moving to the next one. I think we done sufficient debate on this one. I don't think so this needs further debate. We are sorted for this one. And okay, that is pneumonia. It was in the options. Doctor, that pneumonia will not cause that change of position related sputum present, right? And then if it's going to be pneumonia, it's going to be short duration illness and not going to be long duration illness present. So we have to think about more common data in this particular case. Okay, so immature B cell seen. So it was not immature white blood cells. It was immature. Okay, fine. Pneumonia tha. Immature B cell seen. I'm going to remove that. I'm going to add this as pneumonia. Fine, doctor. And I think now you're sorted for this one. Yes. Okay, there is a presence of bleeding in this guy also. There's Pneumonia present / there is bleeding present. Considering that we are considering a hematological cancer, and also the fact that this guy is having a massive splenomegaly. Okay, immature WBC doesn't matter. Okay, fine. If the language is like this with Pneumonia, then this guy could be going into a blast crisis also, no? That is why the bleeding would be present. So considering, our key word for this MCQ, how will you solve this MCQ on basis of immature WBC can be present in all of these cancers. The key word in the question would be spleen palpable till the umbilicus, and considering that massive splenomegaly present, your answer would be given as chronic myeloid leukemia. So, okay. Age 20, why not acute myeloid leukemia? Doctor, acute myeloid leukemia does not have a massive splenomegaly. Acute myeloid leukemia presents with hepatosplenomegaly, lymphadenopathy. It presents with gum changes. It presents with disseminated intravascular coagulation. तो पढ़ना उसको, right? AML के जो manifestations है ना, I think if you go through this, you would be able to solve this. Okay. Okay, it was a female patient, early satiety. Okay, so that early satiety is also explained by the massive splenomegaly component. क्योंकि spleen का size बढ़ जाएगा, it's gonna press on the stomach, and therefore this would help it. This would explain the massive splenomegaly presentation. Okay, so I think we sorted for this one, considering this would be a presentation of chronic myeloid leukemia. Sickle was a separate MCQ, doctor. Early satiety explained, stomach, his tummy will get compressed. You see, in massive splenomegaly, if you listen to the CML discussion that I made, I've explained this concept of constipation and early satiety in the patient. So, okay. So we can move forwards for the next one. Sickle cell anemia in this MCQ. Okay, I'll keep sickle cell in the options as well, though it looks very highly improbable, because sickle cell anemia में तो autosplenectomy हो जाएगी ना, so the spleen is not gonna be present in this particular case. So चलिए next चलते हैं. Preferred drug in management of rheumatic fever. तो rheumatic fever will be having rheumatic arthritis, and for management of rheumatic arthritis, because this is one of the commonest manifestations of rheumatic fever in India, rheumatic arthritis, migratory polyarthritis and joint pain, and for that joint pain manifestation we will have to give aspirin for this particular patient. Okay, Yeah. The reason for aspirin would be the main treatment would be for the rheumatic arthritis component. So it is aspirin and steroids which are going to be primarily used. And if he will ask you in future with respect to secondary prophylaxis, then it is benzathine penicillin. Benzathine penicillin के injection क्यों लगाते हैं? To prevent recurrent sore throats so that they do not develop further damage to their heart valves, etc. But it is joint pain. Okay, and joint pain was mentioned. Okay. Fine, that makes it even much more easier, no? Joint pain in acute rheumatic fever. Benzathine penicillin, Sumit, is given for prevention. It's given for prevention. And if he's gonna himself mention migratory joint pain, okay. If he's gonna talk about migratory joint pain, that's very characteristic and will be treated with the aspirin. So there was polyarthritis also given. Okay. That's giving more credibility to the diagnosis. He's making it easier for you guys. Other three options are antibiotics also. Okay. So can you just comment on the antibiotic? One antibiotic would definitely be benzathine penicillin, and the remaining options, well, if you can just quickly comment before we move on. Yeah, considering migratory polyarthritis, that's a characteristic feature of rheumatic, we will have to answer that as aspirin, doctor. Okay, moving on to the next one. Criteria that differentiates an exudative from transudative pleural effusion. So he's talking about Light's criteria, and he is going to try and evaluate whether you know that exudative conditions will be having elevated protein present. This would be, okay, there was no penicillin in the options. Okay, doctor, I'll remove that. I did not. In the students who got this feedback to me, I mean, that group is like a dynamic one, and none of those chaps mentioned any antibiotics in that case. Okay, ji, let's move on. Okay, let's move on to the next one. Criteria that differentiates exudative from a transudative pleural effusion. That's gonna be related to protein evaluations. क्या डियर आप भी बता, आर से होगा स्टार्ट फ्रॉम स्क्रैच. नेक्स्ट ईयर FMG है तो यश, अगर इतना टाइम है तो भाई मेन वीडियो से पढ़ लो यार. एक साल में क्यों शॉर्टकट लगाना चाहते हो? मतलब माई जॉब एज अ टीचर वुड ऑलवेज बी टू से कि हाँ यार शॉर्टकट है ना, ले ले. बट देन इफ़ यू हैव 1 ईयर मैन, क्या करोगे? 30 घंटा का मेडिसिन करने की जगह पे आप 100 घंटे कर लो ना. यू हैव ऑल द टाइम इन द वर्ल्ड मैन. ओके जी. ओके. स्पेसिफिक ग्रेविटी, that was one of them. Fine. I think that was a very good input. That would be specific gravity. I'm just waiting for another one. Low specific gravity. Okay, low sugar. Yeah, low sugar is there, doctor. Okay, suggestive of a transudative variety. Yep. High cells and protein was there. Yep. See guys, whether it is transudative or exudative, ultimately you have to evaluate, and the bottom line is like there might be a presence of specific gravity. Okay, agreed. There is no rule of sugar also, no? There is no rule of sugar. There can only be transudative as asked. So if it is, let me explain. If the question is on transudative variety, if he's simply saying transudative, your answer is low protein. If he's gonna say exudative variety, it's gonna be high protein. The feedback I got was exudative from transudative. If it's exudative, then I will answer this as high protein in the pleural fluid. If you are saying that the question in the exam, I'll just mark it in green. If you're saying that he was asking only about transudative variety, in Light's criteria we use only two things. One, we use this protein. Second, we use this LDH. खत्म. शुगर का कोई रोल नहीं है, सेल्स का कोई रोल नहीं है, स्पेसिफिक ग्रेविटी का कोई रोल नहीं है. वो सिर्फ हमें बुद्धू बनाने की कोशिश कर रहा है. इज ट्राइंग टू ऑफसेट आवर माइंड बाय राइटिंग व्हाट स्पेसिफिक ग्रेविटी एंड शुगर वैल्यूज. इन लाइट्स क्राइटेरिया सिर्फ दो ही चीज़ें होती हैं, प्रोटीन के वैल्यू और LDH की वैल्यू. एंड इफ यू हैव टू इवेलुएट द ट्रांसुडेटिव वैरायटी, then there is no cellular content present. Absolutely no cellular content present, and we would have to answer it as low protein and normal cellular content. So I think we are sorted for this one. I'll repeat the question once again in case the question of your exam was how do you differentiate a transudative from exudative? It is normal cellular content / low protein, whichever of the two was present. If it is going to be exudative variety, then your answer would be present as high protein in the pleural fluid. So which one to rule out? Okay, question was asking to rule out transudative variety. Then doctor, even if you say about transudative variety, na, high protein would still rule out the transudative variety. Yep. I understand, Muskan, the question cannot be exactly the same, right? That's the objective of a recall. Our objective is to identify कि भाई ट्रांसुडेटिव पूछा या एक्सुडेटिव पूछा. तो ट्रांसुडेटिव में होगा क्या? तो ट्रांसुडेटिव में नॉर्मल सेलुलर कंटेंट होगा, प्रोटीन्स की कमी होगी, स्पेसिफिक ग्रेविटी भी लोअर साइड पे होगी, पर क्या ज़्यादा होगा? दैट इज गोना बी हाई प्रोटीन्स प्रेजेंट. So I think we are again sorted for this one. That would be if it is exudative, B, otherwise it would be given as the data that I've explained. So let's move on to the next one. Okay, no protein, there was fibrin. Okay, high fibrin. I'll change that. That does not change the concept, doctor, because the protein there is fibrin ना भाई. Exudative का मतलब होता है inflammatory. तो inflammatory मतलब fibrin बोलो protein बोलो एक ही बात बन जाएगा ना डॉक्टर. Yes, चलिए let's move on to the next one. Investigation of choice for a patient who's had dysphagia more for solids more than liquids with cachexia for last 3 months. So we are thinking in terms of a carcinoma esophagus. I need to go for a tissue biopsy, and therefore I'll do our upper J endoscopy in this particular case. This is not a yeah, Shrishti, not an issue. Even if you say protein, whether you say fibrin, it's after all the same thing, right? That it would be high if it's exudative, it would be low if it is transudative variety. Okay, so I need to go for an upper G endoscopy, and I need to identify what is, I need a tissue diagnosis, whether it's going to be squamous cell cancer, whether it's going to be adenocarcinoma, and yeah, there would be no cellular content if it is transudative because it's due to congestive heart failure. No cellular content is going to be present with exudative variety because it's inflammatory in nature. So there would be lymphocytes present, there could be cancer cells that could be present, it could be neutrophils if it's an emphysema. So cellular contents are present with exudative variety. जैसे लंग कैंसर है तो कैंसर सेल्स हो जाएंगे, पैरानिमोनिक एफ्यूजन है तो न्यूट्रोफिल्स हो जाएंगे, एम्पाइमा में कन्वर्ट हो गया तो पस प्रेजेंट होगी, फ्रैंक पस प्रेजेंट होगी. तो सेलुलर कंटेंट जो होता है वो फाइब्रिन के साथ हमेशा प्रेजेंट होता है. ओके, अपर जी एंडोस्कोपी विद बायोप्सी. ठीक है जी, ठीक है. इन्वेस्टिगेशन ऑफ चॉइस की जगह पे बेस्ट डायग्नोसिस था. फाइन, बेस्ट डायग्नोस्टिक. लेट्स डू द नेक्स्ट वन. एज मोर देन 70 years. Cool. That is another input. 70-year-old man. CECT was in the options. Okay. Okay, I'll remove biopsy, but we need endoscopy. No, doctor, we need an endoscopy to demonstrate that there is some lesion present there. So what I'll do in this particular case for the best diagnosis would be an upper G endoscopy only. Moving to the next one, he said, what is the amount of glucose that is used for testing while diagnosing diabetes mellitus? So we'll be using 75 gram of glucose. Yes, Dr. Shrishti, you're perfectly right. Upper G endoscopy is the perfect way for identifying a fungating growth, and then we can decide subsequently if we want to do a biopsy from the same as well. Okay, moving on to the next one, that would be 75 grams of glucose that we use. Unlike in pregnancy where we use 100 grams of glucose, it would be 75 grams. Okay, so abhi to I think solve ho gaya, right? I think this is solved. And then we are talking about a patient who is having features of Parkinsonism. There's going to be tremors, there's going to be bradykinesia, there's going to be postural instability. So all these features are pointing in favors of PD. And then he's saying that there is going to be a person is bedridden, died due to respiratory failure. I mean, most of the time, like I've given example of Muhammad Ali, he was a big time boxer, Parkinson disease, he died because of pneumonia. And then he's saying what would be present in this case. Yeah, Imamdar, the next question is coming up very soon. That HB1C limit wala question, I'm just going to show you very soon. That was a question on HB1C good control kaise hota hai, right? So that's coming up just after this. And okay. Age was there in this particular question. Okay. So with the image, okay. So the pathologist would have solved it anyway. The pathologist would have solved it. So cool, fine. But that doesn't change much the data. I mean, the answer still remains the same. Okay, fine. Moving to the next one, which of the following anti-diabetic drugs can cause glucosuria? So we have SGLT2 inhibitors. They're going to act on the proximal convoluted tubule and they're going to prevent reabsorption of sugar and thereby causing a glucosuria. So empagliflozin would be there, and this is going to contribute to canagliflozin, empagliflozin. They are drugs. SGLT2 inhibitors, they reduce CV mortality, but they have a side effect of causing a UTI, and that UTI is basically because of the the glucosuria component. By इस क्वेश्चन के लिए इमेज की ज़रूरत ही नहीं है. वैसे ही आपको पता होना चाहिए कि पार्किंसन डिजीज इज लुई बॉडी, पहली लाइन ये पढ़ाई है कि पार्किंसन डिजीज में देयर इज प्रेजेंस ऑफ अल्फा साइनुक्लिन प्रोटीन एंड लुई बॉडी इज प्रेजेंट, सो it doesn't you don't require an image for the same at all. Okay, then seraglutide was there in the options. Okay, doctor, like we have liraglutide, seraglutide, those are basically the newer drugs which are now available. No, I think you're pointing towards liraglutide and not seraglutide, है ना? Okay जी. Metformin causes glucosuria? No, doctor, absolutely not. Absolutely not. Hypothermia, the rate of reheating is 0.5 to 2 degrees Celsius. I did not get much options on the same, but then it is okay. Okay, somebody's comment I missed. Akshay, ask your question again. Akshay, can you just put up your question again? I think I missed your question there. I'm not able to find it. Akshay, please just post your question once again. Okay, lactic acidosis is with metformin, absolutely. That's one of the side effects, no? If you give metformin to somebody जिसका EGFR अगर lower side पे हो, तो then lactic acidosis can be developing in the case. Okay, fine. Akshay, okay, one question was like patient is going in some surgery, not a surgery. What INR should be kept for that? Doctor, it would require the name of the surgery, no? For what kind of surgery? If it's a joint replacement or if it's gonna be a metallic heart valve replacement, the INR values will be different based on surgery. But it's a good one, doc. I'll keep a watch on this one. And in case you can find, because it depends on, you know, if you're doing a total hip replacement and if you're doing a cardiac surgery where you have to do a heart valve change, the INR values will be kept as different values, because if you're doing a heart valve transplantation, I don't want clots to develop. That's where I'll keep a INR of going up to as much as 2 or 2.5. But if it's a joint replacement surgery, between 1 to 1.5 would still be fine. So I would, Dr. Gurjar, he said Akshay wala question, so that's the answer that I've given. I need the name of the surgery that would be required for this one. Otherwise, the standard answer would be 1.5 to 2 would be a decent one. Yes, labetalol also I think is pointing to the same one. Target value of INR prior to surgery. Absolutely. So Chirag, I think I have just solved. Okay, elective hernia surgery, heart valve replacement. देखो अगर heart valve replacement है, I'll keep a value between 2 to 2.5. अगर hernia surgery है ना, तो अगर 1 आ रहा है, lowest possible को select करना. Keep it as close as possible. Heart valve surgery के लिए we want to keep a INR maximum on a higher limit because there can be chances of coagulation. So hernia surgery, you have to keep it as low as possible. Jahid, the hypothermia correction would be 0.5 to 1 degree. Yes. Hepatobiliary surgery, Chirag, that is gonna be a total game changer, because in patient having hepatobiliary surgery, because liver is the source of all clotting factors na, then I have to keep a different threshold. चलो HbA1c वाले पे आते हैं. Let's do this one. 8-year-old child, या HbA1c वाला पहले कर लेते हैं ना. I think that is better. Everybody is asking about that HbA1c वाला question, so give me a second. Yeah, आ गया. HbA1c वाला question करते हैं. Okay. A diabetes mellitus patient came to the OPD with fatigue and frequent urination, and the question says it is per hour. Nishant, it is 0.5 to 1 degree in 1 hour. That's the rise of temperature that we want according to external rewarming. Anji, target HbA1c कर लेते हैं. Target HbA1c is diabetic patient came to OPD with complaints of fatigue and frequent urination. The HbA1c of the patient, he's saying what is the cutoff used for good sugar control. So good sugar control, option A was 6. Okay, I'll keep it 6. The value for this question would be kept as less than 7. Cutoff is 6.5. Diabetes mellitus is diagnosed when the value is 6.5, but we don't want to achieve a 6.5. It is, sir, INR कम नहीं करेंगे ना जूनियर, because अगर आप INR कम कर देंगे तो उसमें तो फिर क्लॉट्स बन जाएंगे उसके साथ में. So no, it's not 6.5 guys. It is not 6.5. It is like long term control के लिए HbA1c होता है. वो क्वेश्चन आसान है यार, उसको छोड़ो. ये वाला, this is the main thing. That is a value of 7 is good sugar control. I have reference of Harrison as well. That is what I've taught in my routine lectures also, कि अगर कोई high risk patient है तो हम 8 तक ले लेते हैं जिनको hypoglycemia episodes होते हैं. Like old people, if they are having recurrent hypoglycemia episodes, we can take a cutoff of 7. Otherwise, less than 7 is the answer for this question. I think ये डायबिटीज़ के स्टार्टिंग में मैंने बताया हुआ है कि डायबिटीज़ का आप दोबारा से सुनना डायबिटीज़ का शुरू का सिर्फ 10 मिनट. I have said that their cutoff for diagnosis of diabetes is 6.5. But when do you say good sugar control? Exactly जब मैंने microvascular complications आपको बताई हैं, that is where I've said कि भाई if it is gonna be good sugar control, it is less than 7. So the answer here is, and the reference for Harrison is also there. Medico, it's not 7.5 if you are having a textbook reference, and I have explained the data as well. Okay, ji. Absolutely, absolutely. फाइव 6.6, 6.5, 7 and 7.5. I think सर होगा, मतलब ऐसे थोड़ी ना चेंज थोड़ी ना कर देंगे, वैल्यूज़ को थोड़ी ना कर देंगे. I don't think so that they're gonna change the values. Okay. Let's do another question, guys. We still have a lot of work to do. This is a 8-year-old kid. He's having GTCS. He's coming with episode of convulsion for more than 45 minutes. ये बता दो यार 45 minutes से ज़्यादा था या नहीं था. Last 3 months वाला HB1C Gurjar, you perfectly right in that one. And the diagnosis for diabetes mellitus is not 6. Diagnosis of diabetes 6.5, but good sugar control is not 6.5. फिर से बोल रहा हूँ 6.5 good sugar control नहीं होता. Okay जी. Okay ji, let's moving to the next one. 45 or more than 45 minutes. Okay, so this would be a status epilepticus, and for management of status epilepticus we need to be aggressive in a sense that we first need to use lorazepam or diazepam for this particular patient, and once we are gonna be using, for management for this particular case, valproate followed by gabapentin. Okay, I'll just change that. Valproate followed by gabapentin. तो हमें क्या करना होता है स्टेटस एपिलेप्टिकस के मैनेजमेंट के लिए? हम स्टेटस एपिलेप्टिकस में सबसे पहले डायजेपाम या लोराजेपाम जो भी अवेलेबल होगा वो उसको पहले दे देंगे. ओके, इन ऑल ऑप्शंस देयर वाज गाबापेंटिन एक्सेप्ट that was the answer. Okay, so fine, I got it. It is not valproate, man. It is not valproate. It is status epilepticus that needs to be handled first. So पहले इसको लोराजेपाम देंगे, then all other options had gabapentin. That's okay, doctor. Even if I don't put up gabapentin in the options, we can still rule it out. The basic concept is that for status epilepticus, we are not going to start with sodium valproate. First line agent for status epilepticus is lorazepam, and then it's going to be levetiracetam. No sir, it was not GTCS question. It was GTCS with seizures more than 45 minutes. अगर GTCS होता तो valproate होता यार, मैं भी आंसर B मार देता ना. अगर मैं ये क्वेश्चन में I would have answered, अगर if it was GTCS only, I would have given you valproate also as an answer. Simple valproate as an answer. Reason why I'm saying valproate is not because the presentation of patient तो देखो यार 45 minutes से convulsion हो रहे हैं, status epilepticus, you need to give lorazepam for this particular case. Somebody says why not carbamazepine? Sir, we don't use carbamazepine for management of GTCS. Carbamazepine is used for focal seizures. So it would be lorazepam followed by levetiracetam that would be used. I'll say this once again. Levetiracetam and valproate are anti-epileptic drugs. They do not control status epilepticus. That is why I asked you guys right in the beginning, क्या इस सवाल में seizures more than 45 minutes था? The common vocal answer I got was yes. If it is so, status epilepticus present, you need to control it, man. You just can't let it happen. Go through the rapid revision section, listen to the status epilepticus discussion. Seizures more than 5 minutes is GCSE. And the first thing that we do for this particular chap is give lorazepam, and then subsequently we are going to use the remaining aspects in this particular case. Okay. Grace given in question already. Okay. This was not a bipolar illness, doctor. I think this was totally a different question that has been mixed up. There was a separate question I know on bipolar illness that came, but this is not a bipolar illness. Okay, let's move on to the next one. Multiple endocrine neoplasia. MEN1 has 3 P's present, and that 3P would be present would be parathyroid adenoma. So that makes it relatively easier for us. And then is all the features of Conn syndrome except. Conn syndrome would be having excess of aldosterone. This aldosterone will be causing elevated blood pressure. It's going to cause hypokalemic alkalosis, and what you will not have in this case is a metabolic acidosis. Okay, doc, if it is going to be a GTCS question, I have total agreed with you guys. I mean, we'll use sodium valproate initially, but in case in the question it is status epilepticus or seizure for more than 45 minutes, then I'll not agree with you. Then I'll have to give midazolam or diazepam for the question. Okay. Then for Conn syndrome, it would be metabolic acidosis. That would not, I mean, the main feature of this would be, na, aldosterone act kaise karta hai? It causes urinary loss of potassium and hydrogen. And as you can see in the figure, potassium hydrogen being kicked out, so hypokalemic alkalosis will occur and not a metabolic acidosis. So we are sorted out with the option number B. Yeah, GTCS was given in a question, that is okay, but then आगे सीजर more than 45 minutes भी तो लिखा है यार, उसको निगलेक्ट नहीं कर सकते हैं, समझो। अगर किसी को दौरा पड़ रहा है 45 मिनट से, अगर आप हटा दो उसको, आप इफ़ यू कमेंट इन द चैट बॉक्स सर नहीं था 45 GT सीजर्स कंटिन्यूसली, 45 मिनट नहीं था, सीजर्स कंटिन्यूसली था, देन इट वाज ओके। ओके, चलो moving on to the next one. A 30-year-old lady is going to be having a unilateral ptosis, exhibits worsening of symptoms by evening, and she's diagnosed with myasthenia gravis. So we'll be using pyridostigmine, which is a long-acting anticholinesterase agent, and then we would be calling it as option number A. Pyridostigmine is the main drug. We use steroids also in myasthenia gravis, but the preferred drug for management, I think the word was drug of choice nahi tha, it was like preferred drug to be used, then it would be pyridostigmine. Okay. Okay, moving to the next one, HbA1c would be tested on which sample? That would be a venous sample. I mean, if you ever got your blood test done, you take a venous sample and send it to the lab, and we do not go ahead and use a capillary sample for HbA1c. I mean, for blood sugar, we can go for capillary blood sugar as well. Okay, then which value of ABG is calculated? So ABG will calculate PO2, it will calculate PCO2, and then this PCO2 will combine with water. This carbon dioxide will combine with water to form carbonic acid, and that acid will decide the pH. And then subsequently it will break down to produce, you know, two things. That's going to be, I mean, carbon dioxide, water, carbonic acid, and then there's going to be generation of bicarbonate. So, I mean, that bicarbonate will decide the pH value. So this is going to be D as an option. Question was like, what is the WHO standard of high blood sugar? Okay. Muscles का problem है. Okay. Long term control of HbA1c, that's okay doctor, that's okay. What do we derive out of ABG? Okay, it was not random plasma glucose. Okay, random plasma glucose. So this was not HbA1c, it was random blood sugar. Okay. Fine. Random blood sugar would also be a venous sample only, no? You will take a venous sample only. Okay. Okay, ji, we come to this question that somebody was asking me, relations between road traffic accident and seizures in a patient, because we are talking about post-traumatic epilepsy. हाँ, कौन सा कंपोनेंट डराइव करते हैं ना, तो बाइकार्बोनेट होता है ना, क्योंकि जो हम जो सैंपल लेंगे तो ऑक्सीजन और कार्बन डाइऑक्साइड है ना यार, तो ऑक्सीजन की वैल्यू बताएगा, कार्बन डाइऑक्साइड की बताएगा, कार्बन डाइऑक्साइड क्या बनाएगा, कार्बोनिक एसिड जो टूट के बनाता है बाइकार्बोनेट, तो बाइकार्बोनेट की वैल्यू रिड्यूस हो जाएगी. Yeah, doctor, I got it, that he's saying that what value is calculated or which value is derived. That's okay. I mean, both are meaning the same thing only, no? That which value is derived. So derivation would mean this mathematical equation only. कैपिलरी से ब्लड ग्लूकोज कर सकते हैं, हाँ जी, बट रैंडम ब्लड शुगर जो अगर हम करेंगे तो आइडली अगर रैंडम ब्लड शुगर आइडली करना चाहिए तो दैट शुड बी टेस्टेड फ्रॉम अ वेनस सैंपल ओनली. अगर वो करेगा तो फिर देन वी कैन यूज दैट फिंगर प्रिक, नो, एंड कैपिलरी ग्लूकोज कैन ऑल्सो बी टेस्टेड. Okay, 3 sample, gung ho, I'm coming to that also, the 3 sample for rheumatic heart disease, absolutely, that is like 3 samples for identification of organisms responsible for infective endocarditis. Okay. Fine, I think we can come to this question. Yep, we can come to this question with respect to what are the seizures that would be present. Okay. Yeah. It was 1.75. Okay, it was not 75. It was 1.7. We have to select the lowest value, doctor. Always present, not present. Okay. So the values were 1.75. I think it was 17 and 14, 45, something like this. Post-traumatic epilepsy is what I'm talking about, doctor. Post-traumatic epilepsy. So this is the lowest possibility. Usually about 20% of patients who have had a head injury can suffer from epilepsy, और तभी हम इनको post head injury phenytoin देते हैं. So that would be close to about 20% value. That would be perfectly right. So answer would be option number A. And Shadab, thank you so much for that inputs that you're providing. And since I might miss a couple of them, what I've done is just quickly typed in my email ID. And Shadab, if you can just send me those messages on my email as well, that would help me. A big way. Okay, 75% was there, doctor. I mean, these values I got like 17, 45. We had a big debate about them. So I think that. Yep. It was not 1.75. I mean, I sat with students and we did work out this value, sir. Okay. So the reference is from Harrison, guys. I mean, you know, we have textbook reference for everything that I'm saying. It's not that a random value that I'm mentioning. Okay. 75, 45 not present, always present. Okay. Okay. 75, 17 was there. 17 was there. 17 was not. Okay. Let me just remove that 17% wala option and let me just reconsider. Okay, penetrating injury. Doc, penetrating injury to the head would be lethal, no? So it's very unlikely to say penetrating injury to the head. Okay. I think Medical Bluish has given me the closest options for version 2 of this. 45, 75, always, and then never. Okay. So there is a possibility of seizures, doctor. I mean, never to kabhi answer hoga nahi, you know, and 50% of these patients, I'll select the lowest value, doctor, then I'll select 45% for that. It is, I think we did a lot of brainstorming on this. So I think if we are having a textbook reference to that, we should stick by that. So I'll consider that as a difficult one. And we can let it go. I mean, based on the textbook data, I'm having reference also. And we can move on to the next one, which was relatively a easier one. Male patient with infertility, and that gave a triad of situs inversus, sinusitis and bronchiectasis, which would make a diagnosis of this particular case as Kaltenegger syndrome. So that would be an easier one. Okay. You have to select the lowest one, doctor. They have to mention, you have to select the lowest one. देखो, I'll explain the clinical relevance to you. Post head injury patient को जब discharge करोगे ना, once you clear this exam and you do your internship, post head injury patients when they're discharged, they're put on phenytoin. तो वो phenytoin we give it for like maybe a month or so, then we taper it off. तो वो epilepsy के मतलब क्यों देते हैं phenytoin? We give it because there can be, you know, fibrosis or gliosis in the brain post head injury, though he might have undergone surgery for the same. So that can, I mean, if you do not give that, there can be an epileptic episode in a person. So to prevent that episode of seizure that can occur post traumatic head injury, we are gonna use phenytoin, and the incidence of this would be about a quarter of patients. That's what most textbooks say. If I have a textbook or reference, I mean, that's the gold standard. So that is why I'm sticking with the lowest possible value. Okay, ji. Okay. Okay, thank you, Dr. Hania. Do drop me a mail at my email ID. I'd like to keep it and show it at the immigration counter that doctor has invited me to Dubai. So, yep, my email ID, I'll type again. Yes, give me that luxury of just typing that again. Okay, that would be my invite. I'll open the phone and say, okay, here I am invited to the immigration officer. Fine, guys. The answer is Kaltenegger syndrome, and then we have sorted for this one for HB1C as well. And the next one is about a spirometric parameter. He says which of the following conditions will have a FEV1 FVC ratio of less than 0.7 and FV1 of less than 80%. Please let me know if the question is correct. Timed vital capacity of 0.7 and a FEV1 of less than 80%. Yes, guys. Just let me know if the options are correct, because I need to comment on the answer then subsequently. Yeah, Coleman syndrome, doctor, would be in obstetrics and gynecology and would be having, I mean, issues with the anosmia. They would be hypogonadotropic hypogonadism. So I think that would be a separate one. Okay, now moving to the next one, he says which of the following conditions, it's almost correct, it can't be exactly correct, but if it's gonna be, okay, FEV1 decrease किस में होता है? तो FEV1 decrease, the first answer would be obstructive airway disorder. I think there was no COPD. Okay, that's what people are trying to tell me, that it was asthma present. So considering that asthma was the option instead of COPD, FEV1 is low. Okay, okay, right. That's okay, doc. I mean, whether I say COPD, whether I say asthma, difference is reversibility, but both of them is obstructive airway disorders only. So considering that, low FEV1 would be a feature that is seen with bronchial asthma. Okay. Okay, okay. There is wheezing and breathlessness also described in a question. Okay. Great, Anik. So there is a wheezing present in the guy. There is gonna be, along with wheezing, there's gonna be shortness of breath also described. So that's okay, doc. That makes it diagnosis as asthma. The next one talks about a patient who's hypertensive. Okay, inspiratory flat capnography. Okay. Yeah, wheezing is there, female is there, and then there is low FEV1. I mean, considering the 3 parameters that I'm getting in the chat, that would make it a diagnosis as asthma only, doc. Yep, young female. Got it. Thanks. Patient is on thiazides, is having hypokalemia, that standard side effect of diuretics, and he says which drug can be preventing that loss. So we'll be using amiloride for that. So that would be the easier one in this case. Propranolol was in the options for this one. Okay, but that would not change the answer to the question. Okay, sodium channel blocker, yeah, we use it in Liddle syndrome as well. And then there was a question about infective endocarditis blood sample. थोड़े options को मेरी help कर देना. True about infective endocarditis blood sample. Okay, morning, early morning. Okay, fine, that's okay. Wheezing in morning hours. Got it, doctor. Vicky Patel says both asthma and COPD was there. So doc, young female है तो asthma ही लेंगे ना, COPD में तो फिर smoker बोलेगा ना. If he said like a guy is a smoker or he gave some finding, barrel shaped chest, palpable liver, then it would be, you know, the best ones to be answered. Okay. यार मुझे ये बताओ कि जो इन्फेक्टिव एंडोकार्डाइटिस होता है उसमें जो ऑर्गेनिजम्स होते हैं वो एनेरोबिक होते हैं कि एरोबिक होते हैं? पहले मुझे सिर्फ चैट में कमेंट करके बताना कि ये जो ऑर्गेनिज्म होते हैं ना, जैसे स्टैफ ऑरियस होता है, कोएगुलेस नेगेटिव स्टैफ ऑरियस होता है, स्ट्रेप्टोकोकस विरिडेंस होता है, आर दे एरोबिक ऑर्गेनिजम्स और आर दे एनेरोबिक ऑर्गेनिजम्स? सो अगर आप 3 सैंपल एनेरोबिक बोल रहे हो तो 3 सैंपल में सर मतलब ऑल एनेरोबिक तो हो ही नहीं सकता. एनेरोबिक तो क्लॉस्ट्रिडिया होता है सर, anaerobic तो bacteroides होता है, तो it is mainly aerobic organisms present. So I think he was playing the game here that the organisms which are present are aerobic organisms only. So anaerobic वाले को तो consider ही नहीं करना है. I think this was a trick based question. This is not based on 3 samples guys. This would be 2 samples. One would be aerobic और दूसरा हम एक anaerobic वाला ले लेंगे. So it is 3 sample aerobic. नहीं सर, ऐसा नहीं हो सकता. It ideally, I mean this would be, अगर ये होता ऑप्शंस में दैट देयर आर 3 सैंपल्स ऑल एरोबिक, मैं उसको मार्क करके आता 100%. मैं इसको मार्क करता 3 सैंपल्स एरोबिक को. आई थिंक लॉट ऑफ ऑप्शंस वर हैविंग दैट anaerobic thing present or facultative anaerobes present in a question. So considering the fact that anaerobes are not very common organisms responsible for infective endocarditis, this would not be answered as anaerobic. It has to be aerobic only. So it is 2 samples, one would be aerobic and one would be anaerobic. Yep, 3 samples, 2 aerobic and 1 anaerobic was in the option. Again, Dr. Naved, the issue is with the anaerobic organisms only. So I would not like to invest too much of time on this one. So this was 3 samples, aerobic was marked. Okay. आई थिंक वो सिर्फ माइंड से खेल रहा था. उसने आपको ये सारे बैक्टीरिया का नाम पूछने की जगह पे ना उसने एरोबिक एनारोबिक में घुमा दिया. आई थिंक क्वेश्चन सिंपल था. आई सिंपलीफाई थिंग्स फॉर यू. इन्फेक्टिव एंडोकार्डाइटिस के लीडिंग ऑर्गेनिजम्स का नाम नहीं पूछा उसने, वो सारे एरोबिक ऑर्गेनिजम्स होते हैं. उसने एनारोबिक करना शुरू कर दिया, हम उस पर ज़्यादा फोकस कर दिया. द करेक्ट आंसर फॉर दिस वन गाइज वुड बी 2 सैंपल, वन वुड बी एरोबिक एंड सेकेंड वुड बी एनारोबिक सैंपल. दैट्स द स्टैंडर्ड डेटा दैट इज रिकमेंडेड. इट was either it's gonna be the 3-to-1 का sample, right? That three sets of samples, 2 bottles each, 1 hour apart. वो तो एक तो 3-to-1 बताया हुआ है आप लोगों को. So that is like with respect to I'll say that again, 3 sets of 2 bottles each, 10 ml, 10 ml, at a gap of 1 hour, that is 3 to 1, that is with respect to the duration of the samples. कि भाई 3 सैंपल लोगे 1 hour के गैप. यहाँ पे उसने क्या किया, he just mixed up the data with respect to a bit of microbiology, कि भाई हमारे माइंड पे प्रेशर डाल दिया that the organisms are aerobic ones and he's writing anaerobic, facultative anaerobic, so we're thinking oh man it could be anaerobic organisms as well. Anaerobic होता है जैसे Clostridia, Bacteroides, यार वो तो गैस गैंग्रीन वाला organism है, tetanus वाला organism है. So that's not going to cause infective endocarditis under routine circumstances. So the answer is what I have given for this one. I think he played with the minds in this one, guys. He played with the minds in this one. And let's do a couple of these. These are a couple of twisted ones here. Patient with hemolytic anemia presents with dactylitis and chest pain. Yeah, moe PYQ questions as well. Couple of them will be like this. I said couple of them would be like this ones. Okay, don't worry guys, you did very well. जो starting वाले सारे क्वेश्चन है वो तो सारे सही सही तो करें आपने. Yeah, Fmge, you perfectly right. It would still be the data that I have mentioned. That's the correct data to be answered. Yes, Vishesh Chen, please just get the data right from my perspective. The next one is a hemolytic anemia with dactylitis. I think that's a standard feature with respect to avascular necrosis of the short bones, and that would be seen with respect to sickling crisis in a patient. The correct answer for this one would be option number B. And yeah, Vicky Patel, I agree to what you were saying, but then again anaerobic wale pe dikkat aa rahi hai, right? Okay. The correct answer for this one would be sickling crisis. Bilirubin is increased in this case, so I'll just add that as well. That is serum bilirubin of the indirect variety increased in this case. That would be hemolysis. That would explain this from manifestation. Okay, finger pain, dactylitis. Okay, finger pain described. Not dactylitis word, but finger pain described. So that would imply avascular necrosis of the short bones, and that's because of the RBCs becoming very sticky in sickle cell anemia. Okay. Yep. Even if thalassemia would be there in the options. We are done 40 MCQs, doctor, till now. We are just left with 2 more, and I think that would be discussed even by the radiologist as well. So, but still I have kept these 2 issues because I think there was an image of a hemithorax, and I just want to, yeah, Dr. Labita Lal, thanks for that input there. Okay, hemoglobin was also mentioned. Hemoglobin was low in this guy. Fine. We'll put that also. Hemoglobin of something like 5 to 6 grams approximately. Fine guys, that's hemolytic anemia. Okay, moving on to the next one. Pleural effusion was there in the option. Yeah, thoracic mass or pleural effusion. My only point is I've given both the scenarios. One can be ipsilateral tracheal deviation, other one can be contralateral. I'm zooming in to this MCQ. You can see a hemithorax and you can see the trachea moving to the opposite side. So this would mean that there would be a pleural effusion of the massive variety. If it is scenario number 1, I'm color coding that in color red, then the answer would be given as thoracic mass / a pleural effusion, because there would be lung cancer. That lung cancer can cause a malignant massive pleural effusion and contributing to this. And on the other possibility can be, yeah, one is going to be black only, doctor, that is normal lung. Other possibility is that the trachea is getting pulled towards one side, and that would be ipsilateral collapse. But okay, there was no shift given in a question. Then doctor, we'll still have to answer this on the basis of child वन साइड. सर एक्सरे में ऐसे ही होता ना, एक साइड वाइट ही होगी हेमिथोरैक्स, तो वाइट को एबनॉर्मल मानेंगे, जो वाइट वाली है उसको एबनॉर्मल मानेंगे. एंड कंसिडरिंग दैट वील ईदर हैव टू कंसिडर अ कोलैप्स और वील हैव टू कंसिडर दैट एज अ ओके. इफ इट इज अ न्यूमोथोरैक्स पिक, आई एम परफेक्टली फाइन. न्यूमोथोरैक्स में एक साइड पे वाइट होगा क्या, सोच के बताओ. क्या न्यूमोथोरैक्स में एक तो ब्लैक होगा, मैं मान ली तुम्हारी बात, बट वुड न्यूमोथोरैक्स बी हैविंग वन साइड वाइट? एब्सोल्युटली नॉट मैन. In pneumothorax, one side is black, understood. Absent vascular shadows are there, I understand for that. Deep sulcus sign is there, I agree to that. Tracheal shift छोड़ो, मैं सिर्फ क्वेश्चन में ये पूछ रहा हूँ. If you're saying pneumothorax, would you have a white X-ray? Was there a white? Please comment in the chat box, guys. Was there a whiteness in the X-ray or not? If it is a hemithorax, if there's a whiteness present, बस white लिख दो मेरे को कमेंट में. हाँ तो फिर it cannot be. वाइट तो था यार, वाइट के बिना तो नहीं हो सकता ना. एक साइड पे कम्प्लीटली वाइट था और एक साइड पे ब्लैक था, यही फाइनल कंक्लूजन है सर। तो वाइट इसलिए है क्योंकि वहाँ या तो पानी हो सकता है या कोलैप्स हो सकता है, एंड द डिसीजन विल बी बेस्ड ऑन, decision would be based on, yeah, if there is no deviation. Urvashi, you have a very interesting point. If there is no deviation, it can be consolidation as well. Thoda unlikely है Urvashi, because you see consolidation is gonna be all three lobes of the right lung getting involved. थोड़ा सा unlikely है, right? I mean, lobar pneumonia is like one lobe. So to have a consolidation so massive कि आप बोलो कि सर वहाँ पे ना, आई मीन यू नो, टू हैव अ निमोनिया सो सिवियर दैट ऑल द थ्री लोब्स ऑफ द राइट साइड आर अफेक्टेड, थोड़ा थोड़ा अनलाइकली मुझे लग रहा है. बट इफ इट इज गोना बी लाइक सम काइंड ऑफ अ ट्रेकियल शिफ्ट गिवन, देन आई हैव गिवन बोथ द वर्जन्स फॉर द डेटा इन दिस पर्टिकुलर case. And yes, Urvashi has a very good point. I agree to Urvashi, what you are saying can be correct, but a little less likely as compared to the other possibilities that I have given. So I think this was debated by the radiologist as well, and I've tried to do the same thing here as well. But yep, we will try to invest more time into this question and try to analyze this even further as well. Okay ji, fine. Consolidation में shift नहीं होगा यार. Yeah, even if it's a child, would not change the perspective. Would not. Okay. Okay, MedLearning, sure. marvamedicine@gmail.com. Okay, there's no tracheal shift. It's a complete white haziness of the lungs. So Praveen, I'll still answer it as a pleural effusion or a thoracic mass. That would be much more, possibility that the person could be having a malignant pleural effusion. Okay, fine. We move on to the last one. ये पहले तो बता देना भाई था भी कि नहीं था question. That's the last one, guys. That's the 42nd MCQ that I'm discussing at the moment. Age of the patient is 75 years, Falak, and the target is less than 7. Yeah, doctor, ideally we keep a target as less than 7. If it is like high risk patients who are having prone to hypoglycemia, if he was mentioning like person is prone to hypoglycemia, and when you're trying to lower the blood sugar, he's having these disease spells as well, that is when we try to keep a cutoff as 8. But I don't think so there was any 8 in the options. It was I think 6, 6.5, 7 and 7.5. So I showed you a reference of Harrison doctor, and they mentioned two cutoffs only, 7 and 8. Routine patients 7, and for high risk patients who are prone to hypoglycemia, they mention a cutoff of 8. Considering that 8 was not in the options, I think that for blood sugar control it would be a 7 value. Okay, option was melanocyte stimulating hormone. Yes. This is not pro-opiomelanocortin. This was MSH, that is melanocyte stimulating hormone. So yeah, doctor, the hyperpigmentation is there. MSH would be the correct answer for this one. Melanin bhi tha option mein. Okay. So we will not answer melanin, but we'll answer MSH, because ACTH has a partial MSH-like activity. जो lung cancer है ना, this is a paraneoplastic manifestation, and what the lung cancer is doing is that it is producing ACTH, and that ACTH is the one which has a partial MSH activity, which would be responsible for this manifestation. Doctor, okay. MSH, thyroidism, that I could not pick up, hemosiderin and melanin. Okay, so we'll answer it as MSH, doctor. Okay. Fine. So great guys. This was a great discussion. Good to interact with you guys. My count is 42 at the moment at my slide. In case you have any more questions, yeah, Dr. Daisy, I think medicine questions were pretty standard and routine ones, like they always do. Couple of them are gonna be moe, and couple of them are gonna be like pretty straightforward ones, like how many grams of sugar will you use. So I think most of these questions are gonna be like a mixed response present. So thank you so much. नवेद, आई वुड नीड अ बिट ऑफ मोर इनपुट्स की कौन सी वाली सर्जरी है, उसके हिसाब से टेबल होता है ना कि INR का वैल्यू कितना करना है. सो यू मोस्ट वेलकम टू ड्रॉप मी अ ईमेल नवेद, एंड आई विल बी ग्लैड टू रिप्लाई बैक टू यू इन द शॉर्टेस्ट पॉसिबल टाइम. सो 10 wrong, Balwant, you are gonna do great. The remaining guys, if you're getting 6 or couple of them, that's perfectly fine, guys. If in medicine, if you're doing 60% or more, you are doing among the topmost league, right? So I mean, I think you will. It's a good strike rate, doctor. It's a good strike rate. Okay. Hypertensive patient को निफेडिपिन दे देंगे. डॉक्टर अशरफ सोफी, विल नॉट यूज बीटा ब्लॉकर्स इन एन एस्थमाटिक ना. आपने जो कमेंट किया कि एक एस्थमाटिक हाइपरटेंसिव लेडी है, तो एस्थमा में बीटा ब्लॉकर नहीं देते ना, तो लबीटालॉल आंसर नहीं करेंगे. यस. हाँ जी निखिल जी, आप पास हो जाओगे एंड यू वुड डू ग्रेट. Falak, I missed your question. I need inputs on the language. Shrishti, that's great. I am really really happy for this one. RR में change कितना मिलता है? RR मतलब RR interval में. Okay. Medical blues, if you recalled about 240 and 145 are coming correct. So I think the remaining 60, God is going to be kind. God is always kind. God always ensures that we are going to do great in our lives. So I think with this we can finish our discussion. And okay, laxative, rapid clearance wala. Doc, I did not get these ones. So if you can just drop me a mail, I'll be glad to answer these as well. Okay. Okay, Alam is there. Okay, SDH का एक्सरे नहीं होगा मेडिको, दैट वुड बी SDH का वुड बी अ CT स्कैन ना, आपने शायद एक्सरे गलती से लिख दिया. So it would be a subdural hemorrhage actually का CT scan that would be present. So thank you so much guys, God bless you. Kustafkar, you need to drop me a mail for that. Last minute tips, mint green is go out all out, Wayne, ban aggressive, सोना बंद कर दो and study as much as you can. जितना कोर्स एक बार रिवाइज कर लो उतना आप अपना स्ट्राइक रेट इम्प्रूव कर पाओगे. सो आई थिंक ओके डॉक्टर बाशिर, दैट्स ग्रेट टू हियर. 33 करेक्ट देयर. यप समायरा को आंसर कर देना दैट देयर इज अ एंजियोप्लास्टी गिवन. सो कूल गाइस, आई थिंक यू वुड डू ग्रेट. Organ having a high graft rejection, okay, that would be lung, doctor, that would be lung. Angioplasty was not given. Samira, you can let me know the options then for that one. How to get more in the upcoming exam? Study more, invest more time, spend less time on social media, make daily targets, and you'd be through, doctor. Okay guys, I think we can call it quits for today. Thank you so much. God bless you. And I'll be conducting more sessions in future, but yep, I don't think so you would need to attend them. I think you've had enough of me for today as well. And no sir, I think I would suggest you to take a Fmge subscription only and not get into the NEET PG subscription. So God bless you guys. Take care. Bye-bye.